Thank you, Chair and Co-Chair, ladies and gentlemen. I would like to share experience from Vietnam in improving the universal access, reproductive health, family planning services. Vietnam started population and family planning in 1961. One of the important achievements of population family planning in Vietnam is that the population growth rate under control. In 2006, Vietnam had reached a replacement level, which has been maintained for 13 years until now, with total fertility rate in 2019, 2 children. The total population in the year 2019, 96 million. So now the contraceptive prevalence rate at a high level, 75%. Family planning also focus on improvement health care staff and especially for pregnant women and young people and adolescents. So the number of unwanted pregnancy reduced, abortion and reduced, and the maternal mortality rate and infant mortality rate also reduced. The average of life expectancy reached 70 years. 90% pregnant women were examined in at least 3 times during pregnancy, about 90%. 94% birth attendants supported by skilled health staff. This achievement contribute to the social economic development in Vietnam. So I would like to explain why Vietnam attained their achievement. We are explain about the main 3 reasons. Firstly, the government of Vietnam had strong commitment for the implementation of the goal ICPD plan of action. The commitment attained the MDG, the goal of the SDGs. The strong commitment of the government was expressed and detailed in the policy document and the strategy and plan of action and technical and professional guidance in order to conduct throughout the country. Such document was a legal basis for the implementation and management quality of services in Vietnam. The second reason, based on the voluntary and the right of the people in access and prominent features of program in Vietnam, the view of government that the communication, education, advocacy must be done in order to raise awareness of the people about the benefit of program and the right and responsibility of people in implementation the program. In order people support for implementation family planning in a voluntary fashion. So thirdly, in order to meet the demand of the people with requirement of convenient, safe, effective of the methods, in order diversifying, we have some methods. Since the time of program having only one method, contraceptive IUD, to that most of contraceptive method used in the world have been applied in Vietnam, or been condom, injectable, implant, and something like that. Methods are diversified in terms of type, quality, and price. Family planning services were provided by 2 people by many different ways. The first, we provide by the healthcare public healthcare system from center to the community center. And the second, we provide by the private clinical facility. In healthcare system, the quality of services always improve the quality and the update new methods. Especially in Vietnam, we have a network of population collaboration and the village health staff and birth attendant in the community. They working as a voluntary for program. After short training, they went to the household to provide counseling about the reproductive health and family planning for the people in the community. They also provide for people the non-clinic contraceptive, such as the condom or pill for people at home. Sometimes they support for pregnant women, take care of pregnant women in the community, in the household, even though they support for delivery at home. In case of emergency or in some ethnic minority, the people have a custom delivery at home. So in that way, we reach the achievement about the reason. For reason, we also talk about the support, the financing of the government. Now we have many difficult in Vietnam because the demand of family planning and reproductive services in Vietnam seem very high. Also, we have to face with the population issues such as the aging population and imbalanced sex ratio at birth. So we are building new strategy for next period and plan of action for next period from 2021-2030. Thank you very much for your attention.